Hi everyone, welcome back. Welcome to My Baby Experts. I'm Sherry Creso and I'm here to talk to you about another amazing topic as well as an amazing brand that I am lucky enough to partner with. For those of you who don't know me, just real quickly, I am a registered nurse, a certified nurse midwife, and an international board certified lactation consultant. And I've been working with moms and babies for almost 30 years in just about every capacity. And so every topic that we think of that when it comes to you and your baby's health is so important to have not only the products that are going to work as those amazing tools to help you do what you need to do, but also the education and the knowledge that goes with it. And so today is no exception, and I have a very special guest that's going to join us right now so we can talk all about yours and your baby's oral healthcare. Okay, this is something that we don't always think about. Not all parents are thinking about it when you're pregnant or when your baby first comes, but it is so important to get that started early and to make sure that you're setting up a lifetime of healthy oral care. Okay, so I'm going to be joined with Noelle Copeland. She's from Brilliant Oral Care and she's their clinical specialist, and we're going to take you through all the different products that they have that walk you and your baby through all the developmental stages that will be needed to give you the best health throughout from pregnancy all the way through adulthood. Okay, so let me go ahead and bring Noelle in here and we'll get started. Hi, Noelle, welcome.
Hi, Sherry. How are you?
I'm great. I'm great. Thanks for joining me today.
Thanks for having me again. It's good to see you.
Good to see you too. Good to see you too. I think this is a topic that so many parents just don't realize that they need to address and think about
Mhm.
well before the baby even gets here. And so today, like, I really want us to walk through the different products that Brilliant Oral Care provides to moms and babies and really families, like anybody.
Mhm.
But specifically today, how do we best take care of our little one's health and get them set up properly?
Mhm. Yes. Yes.
So let's start. I think we should start from the beginning, and the best place to start is right there when you find out that you're expecting. It's one of those topics that not everybody thinks of when they think of pregnancy, but it's a really important one to consider.
Yeah, I mean, I know that I didn't, and I've been in dentistry for 24 years. And when I got pregnant with my first child, it's not something that naturally comes to the top of your head is, oh, what can I do to make sure that my baby's teeth and oral health develop properly?
Yeah,
Um, and that's a lot on the fact that it hasn't in the past been talked about quite as much as we are really realizing
yeah,
that it's important to start that conversation early. So when the mother is pregnant, and we start that educational process of saying to her, it matters what you eat now. It matters what you're exposed to now, not only because you are developing and growing a
mhm,
little human,
yeah,
but because that little human inside of you is also growing and developing things like their teeth. So we
yeah,
know that the primary teeth or the baby teeth develop between the third and the 6th month of gestation. And the teeth are made primarily of calcium. So having a healthy diet,
hmm,
high in calcium,
hmm,
also high in vitamin D because it helps absorb the calcium, things like
hmm,
phosphorus, green leafy vegetables. All of those things help to develop healthy baby teeth
yeah,
while the baby's growing. And so that's really the first stepping point in the conversation. When I see my patients, I work with Brilliant Oral Care as their
hmm,
oral care specialist, but I still also see patients clinically as well.
hmm,
And I always will start the conversation with my pregnant patients about, what they're going to do for themselves, and then
hmm,
also what they can start to do once the baby is born. And even I'll have, doctors and physicians and
hmm,
nurses, and they'll still say to me, oh, I didn't know I should start oral care that early. And I'm like, yes, you want to start early. The earlier you
exactly.
start it, it's really a training process, not
Hmm.
only for the child, but for you as
Yep.
well as the
Yep.
caretaker or as the parent.
Yeah. One of the things as you were talking about getting enough calcium during pregnancy,
Mhm.
and this was as a practicing midwife, I always thought this was just nuts. I would watch some of these prenatal vitamins that are
Mm.
on the market, even ones that are made from the pharmaceutical companies that literally don't have enough calcium in them, and moms thinking that, oh, if I'm taking my prenatal every day, then I'm getting enough calcium. which
Yeah.
was not the case. And so I just really want moms to be aware that they really need to think about, making sure that they're getting enough calcium from their diet or enough supplementation in addition to some of those prenatals. Some of them don't even have any calcium in them at all. And so you're thinking,
Yeah.
okay, I'm taking my prenatal, everything should be fine. These are the
Yeah.
things you really need to look at. So
And what happens too is that if you don't get enough in your diet, your body will pull it from your bones
that's
and give
right.
it to the baby, and you don't
That's
want
right.
that. I mean, that's just an early onset to arthritic and osteoarthritis problems later on, and we don't. Yeah, I just you don't want your body to do that. So
Yep.
when
Yep.
you're pregnant, your body's like main response is to protect the baby and do what it can to protect the baby, and that
Totally.
is an unfortunate
Totally.
side effect of how we suffer
Totally.
for a lack of something.
And that's what I love about the Brilliant Oral Care line of products. And I'm going to go ahead and bring over a picture here so you can see that there's actually an expecting mom toothbrush.
Yes.
And for you guys, while you're watching, you can see all the different products that we're going to go over today in today's show right here below us. You can click on any of them to go read more, learn more. But this first one that we're looking at is an expecting mom toothbrush. And Noelle, explain to everybody a little bit more of like why oral health during pregnancy? Why can it be an issue and why is it important?
Yeah, so I think the statistic is like 60 to 70% of pregnant women will experience what's called pregnancy gingivitis and even
Mm-hmm.
pregnancy periodontal disease. And so that's a large number.
Yeah.
Um, and if an expectant mom has those symptoms of gingivitis or periodontal disease before she gets pregnant, getting pregnant and all of the things that come along with that, the surge in hormones, the increase in progesterone, all of those are going to make gingivitis and periodontal disease symptoms much worse. And so that increase in progesterone increases blood flow to the tissues, especially the tissues in the mouth. So the pregnant mom's body kind of has this over exaggerated response to the toxins that the
Mm-hmm.
bacteria in the mouth produce. And
Mm.
that's why we call it pregnancy gingivitis. So you can have a mother that is expecting that really hasn't changed anything about her oral care habits. But then all of a sudden, her teeth are sensitive, her gums are sore, she's noticing blood on her toothbrush because her gums are bleeding.
Yeah.
Um, that's a common theme, and that's because of the hormonal changes that are happening.
Yeah.
So, but it's not just like, oh, well, it happens to everybody, it's no big deal. It's still the body's response to that bacteria. So, humans tend to kind of pull away from things that hurt us or that don't feel good and that are uncomfortable versus pushing into them. So if you have tender sore gums that are bleeding and that are hurting when you're brushing them, you don't want to not brush them because then the situation is only going to get worse. So
Exactly.
you can't necessarily change the aggravated tissues response, then you can change the product in the toothbrush that you're using. So with the expectant mom toothbrush, what we've done is we've put very soft and supple bristles on there. It's a very sensitive, microfine bristle that really helps to ease the brushing that's required to actually effectively remove the plaque and bacteria. But it's comfortable for mom, and it can be used with just warm water. You don't even have to use paste or gel on it.
Yeah.
Um, and it's therapeutically soft if you do that. So if you have somebody that's during that first trimester and they're having aversions to taste and to smell like toothpaste and gels, where they just you can't even tolerate the smell of it, then
Yeah.
you can still brush and get an effective brushing just by using some warm water on a toothbrush. You can't really do that with
Mm-hmm.
regular toothbrushes because the bristles are coarser.
And I think that, back to like, why is it important? Why is it oral health? Not only will you have more bleeding, not only are you more susceptible to gingivitis, but that bacteria that gets into the mouth, that can enter into the gums, can affect you, systemically. It can create
Yes.
preterm births. It can create preterm labors. It can affect your heart. I mean, these are all things that we know about why oral health is so important. It's not just about your teeth.
Yeah.
And
And then, yeah,
that's a real big misconception that it's just about your teeth, and it really isn't.
it's not. And
Mm-hmm.
um, there's also new studies now, one New York University study that's showing that pregnant mothers with active periodontal disease that they are at an increased risk for gestational diabetes.
Mm-hmm.
So, if you also have gestational diabetes, that you're at an increased risk afterwards for developing type 2 diabetes. So, all of these little things are interconnected, and they are very important. So,
Mm-hmm.
there's been a disconnection, I think, in the dental and medical communities that, the mouth and the rest of the body are intricately connected. And
Yeah.
so, the blood supply that goes to each one of the teeth in the mouth is the same blood supply that travels throughout the whole body, that goes all the way to your toes. So if you have an infection that is happening in the mouth, that bacterial infection is traveling throughout your whole body if
Absolutely.
it's not being treated. So that's
Absolutely.
how it affects the pregnancy. If you have active periodontal disease in the mouth, that bacteria can travel to the baby.
So, so important. I want to quickly just pull up a close up of the way that this toothbrush looks, because we're going to be
Yeah,
talking a lot about this particular type. It's completely different, okay?
yeah.
Completely different than what you're used to seeing. Let's talk a little bit about the 360-degree brush and the bristles, and that obviously relates to the pregnant mom brush, but it's also going to we're going to tie that into the kids and the baby's brushes in a few minutes. So,
Yeah, so it's fantastic. It is an omnidirectional, multi-directional toothbrush, and it's one of a kind. Nobody else has this
mhm.
patented design. And what it does is it addresses multiple surfaces at once. So one of the things as a practitioner that I educate my patients on is that when you're cleaning your mouth, you're cleaning your whole mouth. You're not just
Mhm.
brushing the tooth. You're not just addressing the tooth. This is one of the things I use when I'm trying to get everybody to floss.
Mhm.
Most people are on the bandwagon for brushing, but
Right.
getting them to floss is like it's like pulling teeth. No pun
It is
intended.
like pulling teeth. It is. It is like pulling teeth.
Almost kind of pulling teeth, but
Yep.
it's much more difficult to get people to floss. But
Mhm.
if they're only brushing and they're not flossing, they're missing a significant amount of tooth structure and area in the mouth that needs to be cleaned. The same goes for the rest of the mouth.
Right.
The bacteria that causes gingivitis, periodontal disease, and cavities is not just on the teeth. It's also on the cheeks. It's on the tongue. It's in the gums. And
Mm.
so why not have an oral care product that you're using to brush that reaches all of those areas? So that's what this toothbrush does.
Mm.
Um, it also has built-in 45-degree angle bristles. And so that's significant because the ADA recommends to have the most effective surface area that you're reaching when you're brushing. You want to put the toothbrush in your mouth and then angle it to 45 degrees so that it's brushing the tooth and stimulating the gum line all at the same time.
Mm.
And that's a great method. It's called the Bass method.
Mhm.
But
It's
the
not the easiest thing to do.
not the easiest thing to
It's
do, and
not.
you have to maintain the angle. So, you're brushing, you're maintaining
Mhm.
the angle, you're
Right.
kind of switching back and forth. But when you have a round toothbrush with the angle built in, you don't have to do that. And so it doesn't matter how you twist or turn your wrist, the angle maintains 45 degrees no matter how you hold the brush.
Right.
This is fantastic for anybody that has any sort of dexterity issues,
Mm-hmm.
where they can't, twist and turn the wrist, or if you have a child, a younger child that you're brush training,
Mm-hmm.
or somebody that's geriatric that might not have the same grip strength that they used to have.
Yeah.
Um, they don't have to try to hold the angle and get the brush at the right, degree. You don't have to think about it. And it makes it easier
It
as
makes so much sense. I mean,
it's brilliant.
it's brilliant. It's
It
brilliant. Okay,
is.
so no, there is a pun intended here, and that name of the company is Brilliant Oral Care, and it makes sense that it is brilliant, but
Yeah.
they really is. So,
And it makes it easier when you're performing oral care for somebody else. So if
hmm
you're brushing your baby's teeth or your
yeah,
child's teeth or
yeah,
your grandmother's teeth, and you don't have to try to get the toothbrush in the mouth, angle it the right way, and then brush the tooth. So it just makes oral care just easier.
so awesome. No, so awesome. Yeah, I wanted to make sure that we addressed, because they're going to keep seeing that round brush, and why? Why is it important? And I'll tell you right now, I've used it, and it is just the softest thing. It is so
And
comfortable.
it
It
feels
it
good. I mean,
feels good. It just
yeah,
I have to admit, like when I first got it,
first,
I was like, this is odd.
Yeah,
Okay, how's this gonna work? And then when I used it, I was like, wow, okay, totally, it totally makes sense, and it
I was
feels
the
really
same
good.
way. I mean, I've been in dentistry
Uh-huh.
for 24 years, and I was like,
Yeah.
oh, this is so different.
Yeah,
But it
totally.
really just feels good because you feel it just brushing the gum line. You feel it massaging the inside of the cheek. If you're on the tongue side of the teeth, then you feel it brushing the side of the tongue. And it's the best tongue cleaner I've ever used because it's
Mm.
round,
Mm-hmm.
especially when you use it on kids, because they tend to wrap their little tongues around the brush
Yeah.
anyway. And so it
Yeah.
just keeps the whole circumference of the tongue. And it's just it really does address multiple areas in the mouth.
So great. So great. Okay, we're going to move on to some of the other products that you guys have. And
Mhm.
like we were saying before, Brilliant Oral Care covers all of the different stages of development
Mhm.
from pregnancy and beyond. And so the first one we're going to talk about is let's see, we've got the tooth tissues here. Okay, so let me go ahead and bring that in. That these are the tooth tissues. So many people think that you need to wait until your children have teeth before you start oral care regimens.
Right.
Let's talk about the tooth tissues, when you use them, and when we should really start with our babies.
Yes. And so starting oral care that early is something that most people will say, oh, I had no idea. I'm supposed to start oral care new baby early, like immediately.
Hmm.
And that has come about because of the training, not only that happens with the baby, but really the training that happens with the parent.
Hmm.
So you're not only getting the child used to having oral care done in their mouth, you're training yourself to do it because one of the most frustrating things as a practitioner that is, and for a parent too, is when you wait too long to start oral care,
Hmm.
and then you have a 2 year old or a 3 year old. I've seen 5 year olds
Yeah.
that
Yeah.
really have had no oral care at home and don't know how to brush their teeth. Um,
Yeah.
and so that creates a lot of challenges. It creates challenges for the clinician because they don't want me doing anything in their mouth because
Hmm.
they're scared. They've never
Yeah.
been to dentist before. It creates challenges at home because the parents are spinning in circles trying to do things, and the kid's like, no, no, thank you.
Hmm. Yeah.
And so we know from studies and we know from research that when you start oral care early, new
Yeah.
babies early, and that carries throughout in a sequence repetition, that the child is much less likely to experience chronic dental disease and issues.
Hmm.
Um, but it starts with training the parent. So a
Hmm.
child is not going to know to do these things. And most of the time, when you have those issues at start, it's because the parent didn't kind of follow through with doing it. And
Hmm.
most parents want to do everything, they can for their kids, and they just don't know that they should.
Yeah, no, and it typically is just, when you know better, you do
You
better.
do better,
And
absolutely.
and everybody wants to do the best for their child.
Mhm. Yeah.
Obviously, we all want to do the best for our child. But this is not the typical thing. Unfortunately, you may not be hearing this from your obstetrician, you're not going to be hearing this from your pediatrician. And so often we just are unaware that we
Mhm.
should be starting this early. When it comes to the tooth tissues, can we talk a little bit about the product itself so that we
Yeah.
can understand, like, this is the first stage of oral health
Mhm.
care, right?
Yeah.
And these are
Yes, this
actually
is the first
tissues for
stage.
being able to wipe the inside of your baby's mouth.
Yes,
Um,
and
um,
I think most pediatricians and OBs are now, saying, "Oh, well, it's a good idea
right.
to clean your baby's mouth after feedings because you're removing the residue and the buildup in the mouth." And that's good because we're kind of finally getting on the same page. Um, 13 years ago, when I had my first baby, nobody said that.
Right.
I knew just kind of intuitively that I should be cleaning my baby's mouth.
Right.
Um, and then I think that it was actually shared with me on my third one, which was, 5 years ago. And so
Right.
that just kind of gives you a range of the time frame that it became uh, more of a shared topic of conversation. But what's
Mhm.
happened is they will say things like, okay, we'll just use a wet washcloth and just wipe the baby's mouth. And what I've learned recently is that you don't want to do that. For one thing, the washcloth is not sterile.
Mhm.
And to be sterile, it needs to be heat sterilized to a certain temperature for a certain
Mhm.
amount of time. And that's just
Mhm.
not happening in our houses. I mean, I,
Right.
my laundry sometimes will spin and sit it. I mean, it's just not getting
Exactly. Yeah.
sterilized. You
Yeah.
don't want to put an unsterile washcloth that could have whatever kind of microorganisms in the washcloth and put it in your tiny little newborn baby's mouth.
Right.
Um, they have just that natural instinct, obviously, to suckle. So they will tend to just kind of suckle on that.
Mm-hmm.
And they found that the little fibers from the washcloth are getting ingested. And
Mm.
sometimes when those fibers get ingested, they also get stuck in the esophagus and in the throat.
Oh, yeah,
And those
yeah.
cause an immune response and all
Mm-hmm.
sorts of issues. So we don't want parents to use a washcloth to wipe babies' mouth. We
Mm-hmm.
want them to use something that's more sterile. So that's where the tooth tissue, the mouth wipes came in. It's a really soft bamboo-based cloth. It's
Mm-hmm.
enhanced with xylitol, which is a natural ingredient that helps prevent bacteria from sticking and adhering to the tissues and to teeth in the mouth.
Mm-hmm.
And so you actually clean by physically using it and wiping the tissues, wiping the gums and the tongue and the cheeks with it. But you're also helping to prevent bacteria buildup by laying that light foundation of the xylitol in the mouth as well.
Mm-hmm. No, it's so great. Such a great product. And what you're seeing here is that it comes in a pack like this, just like you would have like wipes, like diaper wipes,
Mm-hmm. Yeah,
right?
it's a refillable little 30 count white pack.
Gotcha.
And
And
it's
so,
great because you can just put it in your purse or your diaper bag. If you're building it into your routine, I totally get I have a newborn baby and I'm not going to be wiping their mouth every time they feed. Like we talked
right,
about this before, but my kids cluster fed, so it
right,
was like they were constantly just
right.
and eating, and it would just have been ridiculous to think about doing that. I completely understand, but the process is training yourself to do this oral care routine a couple times a day, and you're
Right.
doing that to clean their mouth. So just taking the pack and putting it like on the changing station, or doing it if you give them a little sponge bath, and then just do the oral cleaning at that time. And it's a one-time use. You'll take the cloth, and you can just wrap it around your finger and then just kind of go through and wipe the gum tissues and then toss it.
Mm-hmm. Mm-hmm. And they do come in individual packaged ones or this package that you're seeing here.
Yeah, so we also sell them in like cases where
I think it's like 100 count, right?
yeah, 100 count, and it's like single samples that you
Mm-hmm.
can rip open and use one of those.
Yeah,
I think that the 30 count pack is really convenient because you can, it reseals and there's 30 in there. Um,
totally.
yeah.
Totally. Let's talk about there's also what's on the tooth tissue. There's a
Mhm.
xylitol on the tooth tissue.
Yes.
Can we talk a little bit about that?
Yeah, so xylitol is great.
Mm-hmm.
Xylitol is a natural bacteria inhibitor. So um, it's actually a type of sugar, alcohol, and it's naturally derived from corn cobs and birchwood.
Mm-hmm.
And you can actually use it as a sugar substitute. Like
Mm-hmm.
diabetics will use it as a sugar substitute. But we add it in a small incremental amount into our oral care products like the tooth tissues and the spry gel to
Mm-hmm.
help prevent cavities and to help prevent the buildup of bacteria. And it does that because it's a 5 carbon sugar versus being a 6 carbon sugar, like a lot of other sugars are. So it looks like sugar, it smells like sugar, and
Yeah.
acts like sugar in the mouth. So the bacteria are like, woohoo, sugar, food's here. Um,
Right.
but they can't digest it. They try to. And so when the bacteria ingests the xylitol, it actually ends up killing the bacteria and preventing it from sticking to the tissues.
Got it.
That's how it works. And it works really, really well.
That's awesome. That's awesome.
Yeah.
Yeah, and that's what's in the tooth tissue. And like you said, in the spray gel that we're going to talk about in a little while, we start talking about actually doing some brushing.
Yes.
We'll bring that up and show you as well. Okay, so great. So this is stage one. These again are the tooth tissues. You're seeing the package right here. You can go right to the bottom here and also check them out. But let's take a look at the next
Mm-hmm.
step, right?
Okay.
And so as we move on, we are going to pull up, let me see. So it's the finger toothbrush here.
Mm-hmm.
Let me get it on our screen with us. And there it is. Okay, there's a nice image of it so they can see it. Can you explain? So when would we start using this and how would we use it?
Okay, so the finger toothbrush is where you're actually going to start doing some massaging and brushing in the baby's mouth. So the tooth tissues or the mouth tissues with the xylitol,
Hmm.
you're using that from birth until about the 3 month range. And then you're actually continuing to use that afterwards as well. But
Hmm.
that's your sole oral care um, routine up until that point. So
Hmm.
at about 3 months, you can start to massage baby's mouth
Hmm.
and use the finger toothbrush. So what the finger toothbrush does is it has those little silicone bristle extensions on one side. You fit it on your finger snugly, and then you just put it in baby's mouth and you start
Mm.
massaging and brushing their gums, and they love it. They think it's so much fun. I mean, they just sit there and they grin and they look at you, and it becomes this fun bonding moment. It's very sensory stimulating for them,
Yeah.
but it's it's that process of you are starting oral care early. So
Hmm.
the baby has no reason to have an aversion to having that done. They are responding to it as a normal part of their routine. So if
Hmm.
you're starting that at 3 months old, you are more than likely not going to have any issue with brushing their teeth once their teeth start to come in. So it's
Gotcha.
that starting oral care.
And those bristles are so nice and
They're
soft. We're
so
talking
nice,
like very, very soft
very soft.
feel to it. I actually have one here. I'm gonna
Mhm.
pull one up for you guys so you can see it on my finger. I think you could see this, right? Yeah, here you go. All right, so see, it goes right onto your finger, and then oh, got it on backwards, and then and then and then you have the bristles right here on top,
Yeah,
and
and
they're
they're
super, super
soft.
soft.
Yeah, they're super soft, and you're just it's once again that you're physically wiping any of the residue away that's in the mouth. So no
Hmm.
residue,
Hmm.
um, and you're just brushing it away. And you want to wash it before the initial use, and just keep it clean afterwards. You want to wash it, make sure that there's not anything that's stuck in between silicone bristles. And you can actually get the option of getting it with a hygiene case. That way you can keep it hygienic, if you're keeping it in the
Yeah,
bathroom.
I love that. You could have those little cases, and they come
Yes.
with a lot of your different products to be able to keep
Mhm.
them clean,
Yeah.
which is so convenient because then you
Yeah.
can, have it with you and like in
And it
between
travels well.
uses.
Yeah.
Yeah, totally. All right, so the next product that we have here is the wipe and brush.
Yes.
Okay, I'm gonna bring that up here. And that looks similar to the finger toothbrush, but
Mhm.
it's a little bit different.
It is. So, the thing I love about the company in general is that we are a developmental oral care company. So we really put a lot of time and effort into thinking through the different stages, especially that first year of life. There's a
Hmm.
lot that happens in the
Hmm.
first month,
Yeah,
let alone the first 3, 6, 12 months of a
yeah,
baby's life. I
yeah,
mean, there's so many things that are changing.
yeah.
And so as the baby grows, their oral care grows with them. So, um, you start with the tooth tissues, then you move to kind of brushing with the finger toothbrush. But then sometime around the 4th month, a baby can start to actively teeth. So that means that they're biting down more, they're wanting to chew, they're having an increased amount of saliva, so they'll start to drool. You have to keep a bib on them all the time, and this is
Right.
the preparation of the mouth and the oral cavity for the teeth that are starting to kind of push and bud up through the gums. All of those things are kind of the classic symptoms. So we want you to continue to use, the tissues and wiping and cleaning your mouth, but we also want you to continue brushing. But what
Hmm.
happens is around that time frame, you just have less time to get
Hmm.
your fingers in their little mouth before they, want to chew and gnaw on them.
Right.
So we combined the tissues and the finger toothbrush into the wiping brush. So you take the tissue and wrap it around your finger just like you would if you were using it as a standalone. And then you take the wiping brush and you slide it over your finger, and so then you can wipe and brush at the same time. So you still
Mm.
have the little silicone bristles here to brush the gums, and
Hmm.
then you have the wipe that comes out the hole at the end so that you can get the physical action of getting that xylitol wiped into the mouth at the same time.
No, it's so great. And it definitely protects your finger too.
Yeah, and then yeah, it protects your finger from chewed and gnawed on.
Yeah, totally. And they come in a bunch of cute, really cute colors.
Yes.
Yes, and you can see it right here. There's a picture using it inside a baby's mouth, exactly like Noelle just demonstrated with the tooth tissue. So you'd be getting these together.
Yeah.
You know. All
Yeah.
right.
Is the picture within the high chair? Is
It's
that a good
actually I
picture?
just see the baby's head
Okay, okay. That's a great place to do it. Just, get them in
sitting
the
in a
high
high
chair or
chair.
somewhere where they're,
Yep.
or the little bumbo seats or whatever they have now. I
Yep.
don't use bumbo seats anymore, but
Yep.
just something where you can
Yeah.
kind of get in there and be done with it because they will really just start to,
Yep.
try to chew down
I
on your.
think one of the things that I'm not 100% sure, just so everybody knows, like the difference of like when would you use the finger toothbrush versus using the wipe and brush?
So the difference is when they start to actively teeth. So with
Mm-hmm.
the products, we've kind of done an age range. So
Mm-hmm.
it's not, this is what you use at 3 months. This is what you have to use at 4 months.
Mm-hmm.
Their products are similar, but what it does is it kind of grows with what's going on. So
Mm-hmm.
you can still use the finger toothbrush
Mm-hmm.
without it being um, challenging, then you can
Mm-hmm.
certainly just use the finger toothbrush.
Gotcha.
But if, one thing that when a baby starts to teeth, they can, some babies just are fine with it and they're
Right.
just drool more, but some kids are really just cranky and they have a really hard time with it.
Yeah.
And so
Yeah.
if you're really trying to be disciplined and stick with the oral care routine, don't give up, just move on to the next product that combines those things together into one step for you to make it easier. So that's what we're trying to do as we're developing these innovative products is we don't want you to stop because it gets hard.
Yeah.
We want you to have something else that addresses what you could be experiencing in that stage
Gotcha.
or in that
Awesome.
season.
Awesome. Great. That's great. All right. The next one that we're going to bring up is one of my favorites.
Yeah.
And this is the baby's first toothbrush,
Yeah.
which is also like a toothbrush slash
Mm-hmm.
teether,
Mm-hmm.
which I think is amazing.
Yes.
So you can see the different colors here. Let's talk a little bit about this toothbrush.
Yeah, the baby's first toothbrush is fantastic. I love it.
It's really
It
great.
is a triple tray design, so it has the silicone bristles on it on three sides on one side, on the top side, and three sides on the bottom side. So when
Mm-hmm.
it's in the mouth, it's really, it's encompassing the entire gum area. So
Mm-hmm.
the age range for this is about 4 months.
Mm-hmm.
And so this is the chewable silicone toothbrush. So all of our silicone toothbrushes are made with 100% FDA food grade silicone.
Mm-hmm.
So it's silicone that's meant, designed to be in the mouth and it can be chewed on. So especially with the teether brush, it's meant to be a chewable toothbrush. So
Mm-hmm.
this is for that child that's actively teething. They may have the little red knots on the gums for where the teeth are just about to start busting through.
Mm-hmm.
They're hardcore, really teething down on stuff. And it's great because they can independently use it themselves. So the way it's designed,
Mm-hmm.
it has this H shape to it. You can, let me see, like you can take like a big.
I'm gonna bring a close up of me holding
Okay.
it real quick,
Okay.
so that you can describe it and they can see it close up.
Okay.
There you go. So
Of me
they can
holding
actually
it?
see it. Yeah, I'm holding it right now, real close, so they
Oh,
can
you
see.
are. Okay.
Yeah.
Yeah. And so you can attach a bib clip to the end where that little circular area is, and then attach it to the baby so that it's not falling and they're not dropping it. But then they can hold the end of it, and they
Yep.
just love it, and
Yep.
they can just go to town chewing. And
Totally.
since it's very sensory stimulating. Teething is really important. They need to be able to self-soothe. They need to be able to bite down on things to help relieve that pressure, because that's what's bothering them. That's what's aggravating them, is that pressure of the tooth moving and basically breaking through the gum tissue. So you can
Yep.
imagine how that would,
Yep.
how that would feel.
Totally.
Another great thing about this, I don't know if you can zoom in on your end on the little silicone bristles on
Yeah,
it.
that's what I'm trying to show them right here. So that
Yeah.
right within this piece here that kind of fits right into the gums,
Yeah. This is
there's little tiny bristles.
Yeah, and so what you can do that's so awesome is you can freeze this thing, and
Ah, so great.
it doesn't freeze solid, so it's not like an ice cube, but it gets hard.
You go ahead and show them.
Nice
You got one
little,
in your hand?
yeah, and you get these nice little icicles that form here. And so then you give it to baby and it's nice and cold, which is also sensory stimulating. They love
Mm-hmm.
that. But then the coldness numbs their gums up as they're, just going back and forth and
Yeah,
using it.
totally.
And it's so cute to see a baby. I mean, I've never seen a baby that didn't pick up how to use this really fast. It's like they know. They're like, oh, it's my teether brush. And they just
They know what it is.
it's a perfect size too. It's not, this massive thing. It's very
Show them the clip with it
oh,
that you
and
have
so this
there.
is this is a just like a standard bib clip. This is cute little teddy bear. And it just snaps, you just snap it, and that way you can attach it to baby. There's also things like um, this same thing. You can attach it and then put it on like a um, car seat. What am I trying to say? Car seat handle,
Yeah, or
or
like if or
something
like
so it's not
yeah,
falling.
like a car seat handle, or if you're wearing a baby
Up
in a
there,
carrier,
yeah, a carrier. Yeah,
attach it to the carrier,
yeah.
and that way they're not falling on the floor. Baby's got access to it whenever they need it.
Yes. Yes.
Yeah,
Yeah. All that great stuff. Yeah,
yeah.
these little attachment things are just great for that because it keeps it from falling on the floor, and getting dirty. So, but yeah, the baby's first toothbrush or the teether, we're calling it the teether brush is probably one of our most popular items just because it's so versatile and it's so useful.
I'm going to show it one more time just so everybody
Yeah.
can see which one we're talking about. That's the baby's first toothbrush right here.
And
Um,
I've actually used this on geriatric patients as well,
wow.
edentulous,
Yeah.
um, older geriatric patients that didn't have, maybe posterior teeth, just to get in and rub and stimulate their gums.
Nice. Yeah. Totally. Totally. All right, fantastic. Next up, let's take a look at the next, what we have for the next stage here. And the next stage is going to, actually, we're going to be going from there into what we would consider like your regular toothbrush, right?
Yeah.
And so
Yes.
we showed the circular toothbrush.
Mhm.
I'm going to go ahead and pull up this is actually taking you right from baby through child and kid, right?
Mhm. Yeah.
Okay, so here's what we call the baby, child, and kid toothbrush. Looks similar to the expecting mom toothbrush or the adult
Mhm.
toothbrush.
Yep.
How is it different?
Okay, so again, going back to the company's kind of goal and our brand statement is that we're an innovative solutions company and we want to have products that are developmental and that grow with you.
Mm-hmm.
So what we've done with all of the products is they're all different even though they might have similar appearances. So with the bristle toothbrushes, they all have the same round patented design, but for the baby toothbrush, it's different because of how it's designed specifically for a baby and what that baby is going through at this time frame. So
Mm-hmm.
the stage that we've kind of gone through with the ages for this is about 4 to 24 months, and that's just a range. One thing that we know for tooth eruption is that it varies very differently. So you could have the first tooth coming in at 4 months, but most babies have their first tooth come in around 5 to 6 months. Like my
Mm-hmm.
kids, that their first tooth didn't come in until they were almost one, but then they all just kind of like came in like a freight train all at the
Yeah,
same time. And it was
that's typically what happens. Yes.
but then other children, they erupt slower, just one little tooth at a time. So it's a wide range. So that's why we used a age range when we came up with it for the baby toothbrush.
Mm-hmm.
So it's 4 to 24 months, but the usage of it is for the first tooth. So the stage is first teeth. So for the baby toothbrush, as soon as that tooth is erupted into the mouth, you want to start bristle brushing it. So the child is in this kind of transitional stage where they're still using teethers because they're still teething where the other
Mm-hmm.
teeth are coming in, but then you've got these new baby teeth in the mouth, and you
Yeah.
want to brush them with a bristle toothbrush because as soon as that tooth is exposed to the environment of the mouth, it's susceptible to getting caries or to get a cavity, and you prevent that by brushing the tooth.
Right. I'm showing a close up of it right here
Okay.
because, again, it's hard to see on the camera here the bristles, but we're looking at the baby version. And tell them again how many bristles are on this.
Okay, so this toothbrush has 24,000 bristles on it. And we're able to put that many bristles on it because they're microfine, and the diameter of them is so microfine. Just as a comparison, most children's toothbrushes on the market have like 3,000
Yeah.
bristles.
It's kind of
So
amazing.
not only do you have bristles going all the way around, multi-directional on the toothbrush, you have the bristles in layers. And what that does is that it actually allows the toothbrush to act kind of like a microfiber. So it really just kind of pulls out what's in the mouth because they're so small and they're so close together. So it's a really great toothbrush. And so for calling it like the first teeth, the baby toothbrush, this is, the parent or caregiver is doing the oral care for the child. The child isn't doing it themselves because they don't have the dexterity yet to do that. But you're just going in and you're just brushing those teeth, those little front teeth, the cute ones. The bottom two tend to come in first, and then
Yeah.
the seven will come in after that. But it's just, a few little swipes, and you just, you don't use it any different. You don't twist it or anything. You just brush back and forth and get all the surfaces of the tooth. Start brushing the tongue.
Yeah.
Get used to brushing the tongue too, and then also still allow the baby to teeth, on a teether if they need to have that teething relief for when the back teeth start to come in.
Yeah. Let's talk about, we're talking about these soft bristles, and
Mm-hmm.
I think one of the things that a lot of parents are just unaware of, I know I was, is that chewing on the toothbrush
Yes.
can be a real problem. Let's
Yeah.
speak about that for a minute.
Yeah. So oral care for children should be performed by the caregiver or the adult, other than letting the child, do this independent on the chewable. This is meant to be chewed on. Um, Toothbrush up until about the age of 5 or 6. So at that time frame, then they can be allowed to do more independent brushing. The reason for this is kids just don't have the dexterity to hold a toothbrush properly to be effective at brushing their own teeth. So their tendency, I mean, they'll hold it and they'll get it in their mouth, but they don't do much more than put it in and start biting down on it or sucking on it. And you don't want them to do that. So
Right.
from the age of 4 to 24 months, you're obviously the caregiver, the parent is doing all of the oral care. You're brushing the teeth. You don't really need to use any paste or gels at that age unless your dentist or hygienist recommends that for whatever reasons.
Right.
But you can, just to help prevent any sort of cavities that might happen. But then once you get to about the age of 2 to 5,
Yep.
they're going to want to explore being more independent. This is a time frame where you're kind of doing the I do, you do.
Right.
So you're doing all the oral care. They're watching you. You're talking them through it. So when you're finished, then you say, okay, now, you do what mommy or daddy did. And you allow them to kind of mimic what you've done. You're not handing over the oral care routine to them. You're not giving them the toothbrush and saying, brush your teeth, I'll be right back. And not giving it to them as a teether or something that they are allowed to just chew down on or gnaw on. The bristles on any kind of a toothbrush, especially some of the other toothbrushes that have longer, sharper cut end bristles, they can pierce the gums and pierce up into the gums and cause ulcerations. And that can cause aversions to having the teeth brushed to begin with. And it just can hurt and cause ulcers in the mouth. And it can also damage and break the toothbrush. And you don't want to give, something to a child that they can bite down and damage.
Absolutely.
They're developing teeth, but,
Absolutely. Absolutely. Yeah, no, it seems like, okay, yeah, as long as they're, putting the brush in their mouth and they're trying it out, but it can actually cause real damage. So,
yeah. And just as a rule of thumb, and this goes for any person, not just for kids, if a person cannot successfully tie their own shoes, they lack the needed dexterity to be able to hold and manipulate a toothbrush and use it effectively to remove plaque buildup in the mouth. If they can't tie their shoes, they can't do the motions all around the mouth to clean the teeth. So,
Gotcha.
You're still, this is part of the parent part of the oral care program. You're still responsible though for doing the oral care and then showing them that this is how they do it. And I've got 3 kids. I
Yeah,
know how hard it can be to just brush your kids' teeth sometimes.
totally.
And it can be a battle, but it's much less of a battle when you have the right tools. And if, I even when you're doing it for them, if they start to bite down on it, just say, no, we don't bite our toothbrush. So you're just training them, we're not,
Hmm.
this is not what we're biting down on. We don't
Yeah,
bite the toothbrush.
yeah.
Um, from 2 to 5, and even from, I would say, yeah, 1 to 2 as well if you're using a tooth gel, but you're also teaching them how to spit. So if they
Hmm.
don't know how to spit, that's something you have to teach them to do, especially if you're putting paste or gel on the brush. You don't want them ingesting fluoride toothpaste. You certainly don't want them ingesting that. But any kind of paste or gel um, would be, not safe for them to just be swallowing all the time. So there's a process to the oral care program that the parent needs to, you know,
Totally, totally.
to
Let's go through the different. There's three different stages as we get into these regular toothbrushes. I just like very quickly. I just want them to understand that it's growing with your child.
yeah.
What we just showed you was the baby toothbrush, which is just smaller, more bristles, shorter bristles, soft. And then as you move into child, the handle gets bigger. The brush. Do you want to explain?
Yeah. So what happens
And I'll
is,
show a comparison. I'll pull it up here on my screen so that they can see
mhm,
what they look like next to each other. And
okay.
I'm looking at the lavender, right? The lavender and the aqua is the baby and then the child.
Yeah. So the baby is the like sea aqua color, and
Yep,
so the baby is the one with the 24,000 bristles,
yep,
and it has the highest bristle count of all of our brushes.
yep,
It also has the finest bristle,
yep,
and the diameter of the brush head is smaller. So
yep.
as you move from this brush, it's meant for a little tiny, developing mouth that's going through a
Yep.
phase of teething and budding and having new teeth come in. So it's soft, it's supple.
It's subtle. It's hard to tell, I think, on the camera, but as I'm feeling them, I could definitely tell that the baby brush is softer
Yes, and
and
it
smaller.
and it gets softer as it's wet too. I mean, once
Mm-hmm.
you wet, you're like, oh, it really feels soft.
Yeah.
And then when you move to the lilac, okay, so this is the child toothbrush,
Right.
the stage range. I'm keep saying
Yeah.
blah blah blah.
And by the
The
way, if you're seeing if
range,
you're seeing these metal rings on the end here, that's just coming
yeah,
off our display pieces. So they're not going to come with these metal rings.
yeah, that's just
They're
so we
probably
don't
people are
they
looking
don't
at them
fall
going,
over.
"What's the rings for?"
But the lilac one, this is the child toothbrush. If you were to invert it and hold it up where you could see the end caps on them, you might be able, I'm not sure if they can see it or not, but just the lilac one, the diameter of it is wider. And so this is
Yeah,
for a
you can
bigger mouth.
definitely
So this
see.
is a 2 to 5 year old.
Mm-hmm.
And we call this brush the child toothbrush, and
Mm-hmm.
it's meant for full eruption. So this is the front teeth are all in, and now you're getting the back molar teeth in, which happens between the ages of 2 and 5. So once
Mm-hmm.
those molar teeth come in, they're anatomically different from the front teeth. So the front teeth are incisor teeth. They're meant for biting into things and shredding food. The back teeth are bigger, and they have tops to them because they are the chewing teeth. They are meant to break down the food. So they have pits and grooves and fissures in them that can trap food more easily.
Mm-hmm.
And that age range between 2 and 5 years old is the time frame where the diet changes significantly as well. So they're eating more sticky, gummy, and chewy foods. All of those things can stick in the teeth more. So
Gotcha.
when we designed the child toothbrush, we made the bristles longer and a little bit firmer so that it can reach into those pits and grooves better to remove any food that might be stuck back there.
And then the last one we have here that I'm laying them all side by side so they can
Okay.
kind of see them.
Mhm.
This last one this is the purple one is the kid
Yes,
toothbrush.
so this is what we call the kids toothbrush, and it falls along the same line that the bristles are a little bit longer, which makes
Mm-hmm.
the diameter of the head a little bit bigger because it's for a bigger mouth.
Mm-hmm.
The bristles are also a little bit thicker and firmer, even though it's still very soft.
Yeah.
But this is what we call the kids' toothbrush for mixed dentition. So, sometime between the ages of 5 and 7, your
Mm-hmm.
child is going to start losing their baby teeth and they're going to start getting in their adult teeth. And
Right.
so it's called mixed dentition because you have this time frame between 5 and like 9 to 12 years of age where you have baby teeth and adult teeth in the mouth at the same time, fighting for the space. The jaw's also growing. So a lot of things are happening. And so you might have a little tiny baby tooth that's in there still hanging on by a little piece of, tissue thread
Yeah.
that's right next to a bigger adult tooth. And so it requires longer bristles, and it just, as your child grows and they change, their oral care needs change as well. So that's why the brushes change.
Yeah.
The changing stages that a child goes through as they're getting their baby teeth in, their first teeth, and then their baby molar teeth, and then they start shedding their baby teeth and getting their adult teeth.
It never stops, does it?
It never stops.
It never stops. No, it's just so perfect. And what I love is that, especially when they can start with your line of products and then you have all the different stages for them to continue. And especially for the continuity of like a baby that's getting used to a circular toothbrush like this, that then you have those stages for them to keep working up, so they're not having to switch to go to a different type of brush. No, it's really, really great. You started to mention before when we were talking about the tooth tissues, we were discussing the actually, before we go to that, let's talk about the Sonic. It's so cute, and I wanna go over all the brushes before we move on. So let me bring in the Sonic brush. Hold on. And this is one of the Sonics here. So this is, I have the penguin up on the screen here. So cute.
Yeah. So these are our Sonic versions of, and I've got the penguin too.
Yeah.
So these are our Sonic versions of the round toothbrush design. And so the age range for this is about 3 years plus. And did we talk about, we talked about teething and chewing on and not doing that on, okay.
That's right.
So same thing applies to this. You especially don't want a child to teeth or bite down on something when, it kind of looks fun like a toy.
Right.
And it makes it more fun to brush. But, same thing, you don't want to just give it to them and allow them to walk around and chew on it. But what this does is it introduces Sonic technology to kids. So the difference between a manual toothbrush, which is just, like the regular manual toothbrush, that you are brushing your teeth with one mode of action. So it's just the physical contact of the bristles of the brush touching the teeth and removing the plaque and the buildup that's there, which is great. Most people prefer a manual toothbrush, but the benefit that you actually get when you increase that and have a Sonic toothbrush or an electric toothbrush, but specifically a Sonic toothbrush, is that you get two modes of action that help to clean them out. So you get the physical contact from the bristles actually touching the teeth, but the Sonic motor also provides sonic waves, and it creates sonic lavage or little bubbles in the mouth. So as the bristles are moving around and it's stimulating the fluids in the mouth, it creates these bubbles and waves that travel beyond the bristles. So it's called contact cleaning. So it's two mechanisms. And there are a lot of Sonic toothbrushes out there on the market. Not a lot for kids, especially not a lot for kids that have a gentle motor. One of the things I love about the round design is that because it's round, when the Sonic waves come off the tip and the end of the brush, they don't bounce off the hard plastic back. So it's very gentle. It's about 16,000 brush strokes per minute with Sonic motors. And so to use it, you push it once and it has this great LED light that comes on. The kids love this. They're like, oh, I can see my teeth.
Yeah.
And then you as the parent, you can see in there too. So you can show them, and it makes it interactive and fun. And then you press it a second time and that turns on the Sonic motor. And it goes for 2 minutes, and it pulses every 30 seconds. And that pulsing is designed to help train the brush train. So you have quadrants in your mouth, 1, 2, 3, 4. And so you want to brush each quadrant of the mouth about 30 seconds. So that's what the pulsing is. It's supposed to signal you to move to the next quadrant of the mouth. Gotcha. And then it auto shuts off after 2 minutes. So the 2 minute time frame is how long the ADA recommends that you take to brush your teeth to remove the most plaque buildup on the teeth for adults and for kids. And for kids, you can have them sing the ABC song twice, and that's
Uh-huh.
about 2 minutes.
And
So
that's
if
2
you're doing
minutes.
it in their head, or if you're
Uh-huh.
doing it for them while you're brushing your teeth, you can be like ABC. No.
Totally. Well, I right now I have a picture of both the duck
Okay.
and the penguin up, and
Okay.
they're both adorable. Either way, you can't lose. I think these are great gifts too. I mean, I'm thinking
Yeah,
of like holidays coming, what could be better than to buy something that's healthy?
they are. And so what you do too is you keep the base, the penguin or the duck, and then you just change out the brush head. So it's a twist and snap to change it out. And then it runs on one AAA battery too. So the base twists and comes off, runs on one AAA battery, which is great because a lot of sonic toothbrushes have chargers and plugins and all that kind of jazz that you have to keep in your bathroom, which just makes it more difficult. And so this runs on one AAA battery. It has a flat bottom to it as well, so it sits nicely on the counter or up in the cabinet in the bathroom.
Yeah.
And it's just super cute. You're right. It does make a nice little gift. And we are going to have a whole character line. So Mr. Duck and Mr. Penguin, or Mrs. Duck and Mrs. Penguin, I don't know which they are going to have siblings soon. And so we have a dinosaur that we're working on, and he's super cute. And
That's awesome.
yeah,
That's
I'm excited.
no, they're adorable, and they're nice and small too. Like the grip is small. It's easy for little hands to hold. It's
Yes,
made for them. I mean,
yes.
these are made for them, and so not only are they cute, they're gonna have your child want to actually use them, but they're really effective too. And just like everything Noelle just went over, being able to really clean that mouth.
Especially too, if you didn't start oral care early,
Mm-hmm.
and you do have a child that's 3 years old or 4 years old who
Mm-hmm.
doesn't want you to brush their teeth.
Mm-hmm.
Okay, this is a great way to be like, oh, but brushing can be fun.
Yeah, totally. I could
You don't,
totally see that.
yeah, and you don't have to use the sonic motor to begin with. That's why it's a two-button push. So you could just turn the light on and then use it without the motor, and then transition them into the motor or to the sonic part of the toothbrush if they're having a hard time just doing brushing.
Yep.
So
Yep.
that makes it, a stepping process for a parent or caregiver that might be struggling with, doing something at home.
Completely. Let's move on to speaking of gifts. We have this oral care kit that actually
Oh yeah,
is a great gift to give yourself too if you want to try out all the different brilliant oral care products, all the different stages for
hmm
baby. This is a really great way to do that with all the different, it's like a sampler of everything.
right. It's
Um,
it's great. It's a great value
mhm,
because it comes with pretty much everything and that we've talked about. It comes with 5 items, a 30 count pack of the tissues. So it comes
mhm,
with a 30 count pack of the tissues.
mhm,
It comes with all three of the silicone
mhm,
toothbrushes.
mhm.
So it gives you all the oral care that you need for the first 3 years of life. And we
Totally.
designed
And
it
a
that
nice gift bag
way, and a
too.
nice little
So
gift bag.
if you're thinking about, holidays or you're thinking about a baby shower gift, I think this is a great gift to add
Yeah,
to like those basic essentials. I mean, this is
yeah.
like these are baby essentials is
It
basically
is.
what this
It
is.
is. And it comes with the baby toothbrush too. So it comes with
Hmm.
the 3 silicones, the baby bristle toothbrush, and then the mouth tissues. And I'm pretty sure that each one that's ordered also comes with the oral care guide, which basically has a version of what we're talking about in the
Hmm.
guide. Kind of
Yeah.
go over, the stages and
That's
what
so good because this is a lot of information.
it is.
Obviously, it's a lot of which is great. That was our intent, was to give you lots of information. And what's amazing is that this video will be here on my channel, so you can refer back to it as you need it. As your baby's moving to the next stage, you're like, oh, what did they say again? Come watch it again. You can always access it. But it's great to have that booklet that will also walk you through the instructions and give you the information that you need.
Yeah, it is great. And it starts with pregnancy. The
Hmm.
very first page is what you can do in your pregnancy. So if you're ordering
Totally.
this as a gift for a baby shower or a grandparent ordering it for their first grandchild to give to, the expectant mom. I have a lot of dental offices that have
Hmm.
really embraced the educational part of, educating expectant moms. So they'll order the kits and they give it to their patients, and they're like, here's everything that you're going to need for the first 2 years of your child's life, and here's how to use it. And I just think that's amazing because that's what
Totally.
needs to happen so that we can prevent dental disease in children later on.
Totally. We have one last product that we didn't talk about that I'm going to pull up really quick,
Okay.
and that's the tooth gel, the spray,
Oh,
the
yes.
xylitol. We did talk about xylitol before with the tooth tissues, but this is what you would use as like the toothpaste.
Yes. So
Um,
xylitol is amazing. I love xylitol.
mhm,
I use it myself and my family. And so we have xylitol in two ways. We have it in the tooth tissues, which are suitable, as we said, to use
mhm,
on a newborn. And then we also have it in the spray gel, which is 3 months plus. And the difference between is the amount that's in here. So there's a gram per serving here. And in the wipes, it's much less than that.
mhm,
And so what xylitol does, xylitol is a sugar alcohol. It's naturally derived from different sources, but it can come from like corn cob and birchwood. And a lot of diabetics will actually use xylitol as a type of sugar substitute in their diet
mhm.
to ingest it. But when you use it topically, it actually inhibits the bacteria from proliferating and from sticking to the tissues in the mouth. And it does this because xylitol looks like sugar, it acts like sugar, and it tastes like sugar to
Mhm.
the bacteria, but it's not sugar. It's a 5 carbon sugar versus being a 6 carbon sugar. So the bacteria gets excited. It's like, yay, sugar's here, and which is its main source of fuel and food. So it
Mhm.
goes to ingest the xylitol, but it can't. It can't digest it. And so what ends up happening is the bacteria can attach in the mouth to the tissues or to the teeth, and it ends up killing a lot of the bacteria, and it helps prevent cavities that way. And
That's
so it's been
awesome.
an integral ingredient, not only in oral care products, but they're also adding it now to like nasal sprays and ear drops
Mhm,
for the same reason that
mhm,
it prevents cavities in the mouth. It also prevents yeast overgrowth and ear infection. So it's
mhm.
really a phenomenal, tool and ingredient.
So great. So
It is
great.
great. It
So
is great.
great.
Um,
Um, okay.
Oh, and that's what I was going to say is the flavor. So the flavor of the tooth gel is a very mild strawberry banana. A lot of times, like some of the kids stuff on the market, like sparklies and bubblegum flavors. I mean, it's just so saccharine and sweet. This is a very, very mild flavor of strawberry banana. It's not overpowering at all. It's very palatable. I have adults that use the strawberry banana because there's a lot of people now that are allergic to cinnamon and mint. I've found out in my own practice working with patients, they can't have mint and they can't have cinnamon. So they're like, what do I use?
Great.
Oh, strawberry banana spray gel. So it works. It's very mild, very palatable. And then the tooth tissues, the mouth tissues, the flavor on that, I wouldn't have even known that it was flavored really if somebody hadn't told me. But it's just a very mild. They call it bubble gum, but it's really like a tutti frutti, just enough to give it a little taste of something.
Yeah. No, that's so great. So great. All right. Well, that is there are so many, as you can see, there are so many great products that
Mhm.
Brilliant Oral Care makes for oral health. And I hope that this whole episode here gave you not just this was supposed to be an overview. Can you imagine? There's so much information.
And
And this was just
I'm sitting here thinking, oh, I didn't say this. Oh, I
well,
didn't
we're
say
gonna come back. We're
that.
gonna come back, and we're gonna be able to do more for sure. I mean,
Yeah.
this was such a great episode to be able to really understand what at least get the basics of where to start, what to do, and the most important thing is awareness. Is like
Yeah.
really having that in your awareness. Is if you're a mom right now, if you're watching, if you're expecting, you are so ahead of the game just to
Oh,
even
yeah.
know that you should be thinking about this. If you already had your baby and you haven't started an oral care regimen yet, no guilt. Okay, this is a
Right.
guilt-free zone anyway. Okay, that's not what this is about. It's about learn when you're at that moment. If you know more, you'll do more. It's never too late to start.
Yeah. And if you're a parent that has a 2-year-old or a 3-year-old and you haven't really started, it's not a guilt thing there either. I mean, like we said, I totally get it. I have 3 kids. I'm a dental professional, and
Yeah,
there's some days where I'm just like, I don't care if you brush your teeth, just go to bed. So, I
totally.
mean, I get it. Like, I understand the
Hmm.
whole process of it. And that's why, we do this. That's why we talk
Hmm.
about what we talk about. It's just,
Absolutely.
I just want to support mothers.
Awesome.
Motherhood is,
Awesome.
it takes a village, a
Absolutely.
village.
Absolutely. Absolutely. So you can go ahead and check out all the products right here below us. There's everything we talked about in today's episode. Click on them, learn some more, and join us again for the next one. Noelle, I can't wait to have you back.
Thank you. I can't wait to be back with you.
All right, everyone. So enjoy, and we will see you soon. Thanks so much for joining.